Okay, hello everyone. Welcome to our presentation of chapter 14. This chapter is presented by Shelby, Riley, and Mars. So in this chapter, we are going to explore the following topics. First, we are going to talk about phonological awareness fundamentals before we delve into some benefits of phonological awareness instruction. And then we're going to cover the focus of this chapter, which are the structure of intervention and intervention activities. Before we come to the conclusion, we are also going to cover scaffolding learning and also how to bridge phonemic awareness and phonological processing. So the first section of this chapter is phonological awareness fundamentals. Um, the question you may want to ask is why phonological awareness is important. There are 3 points in this chapter. First, phonological awareness enables the alphabetical principle and sound letter correspondences, which we have read a lot during the past 2 weeks. And secondly, phonological awareness is a strong indicator of later reading success, and it is often deficient in kids with speech language impairment or reading disabilities. And the last point is there is this reciprocal relationship between phonological awareness and reading and spelling. So phonological awareness usually develops along with reading and writing or spelling. So phonological awareness is not just a prerequisite of reading and spelling. We are also going to talk about more about this reciprocal relationship. Next, we would want to discuss some types and tasks of phonological awareness. These questions can be explored from many perspectives. First, we can divide phonological awareness into shallow awareness and deep awareness. So shallow awareness requires very minimally active judgments. For example, generating rhymes, matching initial phonemes. And deep awareness, on the other hand, it requires demanding manipulation. For example, swapping phonemes. One example would be the letter TOP. So if you swap the phonemes into like POT, then that would be a totally different word. A second perspective is to divide phonemes, phonological awareness tasks into phonetic awareness and phonemic awareness. This concept could be very confusing. So phonetic awareness usually requires expert level of awareness. For example, some sounds are voicing, some sounds have aspiration. Those are some awareness that only I think teachers or SLPs would have. They are not for children. And phonemic awareness, in contrast, it is critical for alphabetical writing system. So children are supposed to have this ability to recognize discrete speech sounds. Although there are other concepts that you may want to know, for example, rhyme awareness and syllable awareness. We are not going to talk about much about these two concepts because in the chapter, the author mentioned that these two awarenesses are less important in children's literacy development. Now we are going to talk about how children's phonological awareness develops. According to this D-Bell's 8 benchmarks, at the age of 3 years old, children should be able to recognize or develop awareness of a rhyme, syllable, and some simple phonemes. So at the age of 3 years to 4 years, many children would naturally develop the awareness that sentences include many words. and words can be divided into one or many syllables. Also, syllables include many phonemes. Again, this DBEL's 8 benchmarks. It is an assessment tool developed by University of Oregon. And from this benchmark's official website, it said this benchmark is very useful, and clinicians can use only 1 minute to help decide the child's language development some milestones. Next, in terms of children's isolation order, sorry, in terms of children's ability to isolate phonemes, here is the research result. For most children, they would be able to isolate initial phoneme before they can move on to final phoneme, and at the end, medial phoneme. That means most children, for example, in the word of a top, most children would be able to isolate the T sound, and then they will isolate the P sound. And at the end, they will reach the medial phoneme, which is the all sound. And in terms of children's ability to manipulate phonemes, most children would first develop skills to segment phonemes, then move on. They would be able to delete phonemes or substitute phonemes, or at the end, even the skill of transposition. And transposition of phoneme means swapping phonemes, just like in the example of TOP and POT. Okay. So next, we're going to talk about the reciprocal relationship between reading, spelling, and phonological awareness. So according to this chapter, children's reading ability and spelling ability would usually help promote their development of phonological awareness. And in turn, the development of their phonological awareness would also help promote the reading skills and writing skills. In addition to this reciprocal relationship, children's orthographic skills or orthographic knowledge would also help promote their phonological awareness development. So, next topic we want to talk about is what are the benefits of phonological awareness instruction. So the first part covers how much of the intervention and the benefits for whom. There are many studies, and here I listed some results of these research. So the first result would be that intervention program, which include letter training, is better than a program without letter training. A second result is intervention within a small group usually is better than intervention in the whole classroom or intervention with individual child. 3, the best intervention duration would be 5 to 18 hours. I assume we're talking about for the whole semester here. And the fourth would be intervention with younger children, usually before the second grade. It's better than intervention with the older children. And the last benefit is that intervention with language learners, with English language learners, could be as good as intervention with English native speakers. Okay, the second part of the benefits is how to select skills and in which order. So first, we want to know that research suggests that if clinician focus on one or two skills at a time, it's the best. For example, you may want to focus on children's ability to segment phonemes or segmenting and blending phonemes. Secondly, it is better to follow a first phoneme segmenting and blending order. That means first you may want to help the child to uh, isolate the first phoneme of a syllable, and then you wanted to develop their ability to segment phonemes, and then you want to teach them how to blend phonemes. And the third is follow a vertical order is better than follow a horizontal order. And I believe Riley is going to talk about what is vertical order. So number 4 would be rhyme and syllables are not awareness in rhyme and syllable usually are not very helpful, which I mentioned before. So the last result would be working with some rhyming books or writing tasks is as good as working with some contrived activities. That means clinicians can use any available materials to work. You don't have to self-made your own materials. Okay, now it's the focus of this chapter. We're going to talk about how to do intervention. So the first skill I'm going to talk about is phoneme isolation and segmenting. So as mentioned before, phoneme isolation and segmenting is our top priorities. And some researchers would use these terms interchangeably. So you can say it's a first phoneme isolation, or you can say it's a first phoneme segmentation, or some researchers would call it onset rhyme segmentation. For example, in the word of a cat, the first phoneme would be the K sound. And the reverse of phoneme isolation is phoneme blending. And usually phoneme isolation works better with blending. That means your first step with phonological awareness intervention could be um, teach children how to isolate phoneme. At the same time, you can also do blending. And after first phoneme isolation, maybe you want to move to last phoneme isolation, which is more difficult for most children. And the last step would be medial phoneme isolation. For example, in the word of a cat, the median phoneme is the A sound. The chapter mentioned that clinicians should only work on medial phoneme isolation like accidentally. For example, in the middle of a class, you give it only 5 minutes to work on this. Now I'm going to head on this to Heidi.
Thanks, Mars. So, the section that I'll start talking about first is the structure of intervention, talking about what the SLP should be targeting in therapy and some other phoneme skills that Mars briefly touched on and kind of introduced us to. So, as Mars talked about, first phoneme awareness is very important for children in learning literacy and having phonological awareness. So, this can be seen in generating new words, categorizing first phonemes in a series of multiple words, matching sounds, also sorting by first phonemes. And segmenting spoken words and rhyming are important in phonological awareness, but they are not as much of a focus in teaching or targeting in therapy. There is an emphasis on starting with isolation, then segmentation, and then blending, which is something Mars talked a little bit about. And that is how the structure of therapy should go. I also want to touch on how for preschoolers, first phoneme awareness is a very important target. It's the primary target. So isolating, matching, categorizing, that type of thing. And then once you get into kindergarten and some of the older ages, you want to look into phoneme segmenting. Then vertical and horizontal goal order. So this is how intervention can be structured. As Mars touched on, vertical is teaching one skill at a time, and it's a lot easier for a child to understand and get used to because you're only focusing on one step at a time, making your way through, and then you focus on mastery before moving to the next step. So this could be seen as working on rhyming in week 1 or the initial phoneme, and then mastering that before you go to the next week working on the final phoneme in words. And then on the opposite end is horizontal or simultaneous skill order, which just means that there are several skills being taught at the same time. They're taught in shorter cycles, emphasizes varied practice, but is much more complex as multiple skills are being taught at once. So then, RISE is an intervention method that we have seen or read a little bit about so far. The R stands for repeated practice opportunities. I stands for intense service delivery. S is systematic learning support, and then E is explicit focus on target skills. So RISE is primarily focused on giving a child a high number of response opportunities within the session. And then the intensity level is about 20 hours of phoneme level instruction. For systematic learning support, you're going to provide like structural scaffolds, which is something Shelby will touch on a little bit more, but that's looking at doing things in small groups, doing simple tasks, and then the explicit target skill is just maintaining focus only on phonemic awareness. The plus in this model stands for other learner factors that may affect a child. So anything like attention, motivation, and engagement are things that should be taken into consideration when planning intervention strategies and activities. So then getting into some activities that are pretty common, there are 3 main categories, including name play, some game activities, and then sound talk. They can occur within a single or multiple skill focus, so you could use any of these activities in a vertical or horizontal skill ordering. So to dive in a little bit more, name play is just all about discussing sounds in children's names. So it's a very short, flexible activity. It doesn't require any special materials. You can just talk to a child about the sounds and the letters in their name. You could use alliteration, like saying terrific Tommy, comparing name lengths, and counting out sounds. So it's a very short and easy activity to do. The single skill game activities are going to be requiring more materials with maybe some visual supports or actual cards to play a game with, but they're designed to teach a skill. And this could be with phoneme isolation and matching, maybe blending and segmenting sounds and words. Also, the emphasis is heavily on speech sounds. And then we can talk about sound talk through verse books. This could be like rhyming books. You could use these in vocabulary, even math concepts. SLPs are guiding children through rhyming identification, first phoneme isolation, and phoneme segmentation. And then we can talk about sound talk through writing, which is kind of similar. Writing can be used as a powerful tool for phoneme awareness. So you're taking anything that's in writing or that the child writes themselves and talking about the sounds and the letters in that thing, whether it's a grocery list or a book, messages, that type of thing. And then SLPs would be narrating sound structure during writing. And then finally, talking about how an SLP does play a large role in speech sound awareness, but not so much in phonics. So the expertise of an SLP is only on the phonological speech sound awareness side of things, and it's important to distinguish the difference between the two. So now on to Shelby.
Thanks, Riley. So, as Riley briefly mentioned, I will primarily be talking about scaffolding learning. So, scaffolding learning is an intentional and strategic support that can be provided in a variety of ways, as we will discuss throughout the presentation. So, the purpose of scaffolding learning is that it is supposed to assist children in completing tasks so that they are first able to complete the task, but then are also able to gain further independence. So, scaffolding learning will assist the children in being able to successfully respond to the question, to the prompt at hand, and will also help them learn how to do better next time. And as I mentioned, this will, over a period of time, hopefully encourage the child towards further independence. So there are several different structural scaffolds that are put into place in the realm of scaffolding learning. And scaffolding actually comes from a building term that is known as temporary structure. So these temporary structures can be seen through several different environmental simplifications in a variety of settings. Scaffolding learning, and more specifically, structural scaffolds, can be seen through visual supports, group arrangements, activity sequences. These could be seen as putting a child in a group to complete an activity. Honestly, the opportunities are endless when it comes to structural scaffolds. So, specifically talking about interactive scaffolding, so this is when dynamic facilitative moves are made explicitly by the instructor. So, for example, this could be seen as when an SLP matches the nature towards the amount of help the child may specifically need. And the purpose of interactive scaffolding, once again allows the child to answer the question more effectively. It pushes them towards further independence. And overall, you can see interactive scaffolding being used primarily in activities with less structure. Moving right along, we're going to talk about scaffolding blending and segmentation. Scaffolding blending is when the SLP would prompt the child with micro separations in hopes that the child will be able to then identify the word. So, for example, the SLP would say, "What word is this?" And instead of just saying bread and assimilating all of those sounds together, they would focus on the B, then the R, then the E, and then the D. And they would work on each of those sounds explicitly by themselves in hopes of grouping the word together in the end. Moving right along onto scaffolding segmentation. This is when children learn to represent a phoneme with a movable tile. They call this in the chapter the move it and say it procedure. So, for example, you want to make sure that you're asking the child not to focus on each sound individually, but to focus on the sounds and be able to move them throughout the word. So, for example, you would say, "You count the sounds in man." "I am listening." You want the child to identify that the sounds are interchangeable and when put in a certain order, give the word man. When we talk about the very start of phonemic awareness, children may require an extra push as each child is individually different. This can typically result in some fundamental confusion. So, when you ask a child to identify the sounds in the word, most times they're just going to identify the word rather than identify the sounds in the words. So, most SLPs can use the term or the sentence, listen, point to your ear for the sounds. So you want to really make sure that you're focusing on phoneme production and phoneme awareness, as both of those practices help in the start of phonemic awareness. So during this time frame, you really want to focus the child's attention to sounds of speech. And quite frankly, correct practice in this area can actually result in orienting 3-year-olds to sound talk. So moving on from phonological awareness to phonological processing. Phonological processing refers to the cognitive skills that are involved in awareness, storage, and retrieval of phonological representations. And so, sidebar, deficits in each of these areas will typically result in children with a language impairment or reading disability. And so when looking at younger children, which we will later on look at older children, phonological awareness is the biggest predictor for younger children, resulting in reading impairments or language disabilities. And so at this time, verbal working memory and word retrieval are more significant for older children, as we'll discuss, between that bridge of phonological awareness and phonological processing. When we look at phonemic, I'm messing all my words up, phonemic awareness for older students, benefits of phonemic awareness currently right now are not clear in regard to older poor readers. However, it has been found and stated in the chapter that reading and spelling intervention are helpful when it comes to phonemic awareness. And once again, this can be seen throughout a variety of ways. For example, integrating phoneme level awareness into phonics-based interventions. The reading also discussed the intervention approach of LIPS, which focuses on phoneme segmentation and word decoding. As Riley talked about, RISE plus, and then also just focusing on syllables combined with morphological analysis can also be beneficial for older students. Moving right along, we have phonological memory intervention. So just to provide a broad description, phonological memory is the short-term mental retention of speech sounds. And so each time a child, a student is going through that brief memory trace, they're actually activating their verbal working memory. So that can be quite apparent in the everyday life of most people. There is no clear way of directly treating phonological memory as stated in the chapter. However, there are several workouts that can target and can assist in phonological memory intervention. This can be focusing on segmentation of long words, analyzing the deletion and the substitution and the transposition of phonemes in words, and then lastly, just that systematic practice of a variety of phonological items. Phonological retrieval intervention, difficulties can ultimately appear through both reading and spelling. So when a child is demonstrating difficulty with phonological retrieval, this can appear through hesitations and pauses and fillers of verbal speech. And when reading, it can appear through slower and less rapid and automatic reading. However, phonological retrieval intervention can be worked on throughout several different language approaches. For example, you can work on improving the lexical depth and elaboration in traditional semantics treatment. You can work on using phonological and semantic cues to aid word retrieval and come up with a cue prompting system. And you can also teach children how to cue and organize themselves to find their words faster and more accurately, as I just touched on. Lastly, in regard to our chapter as a whole, concluding our presentation, phonological processing is critical to fluent reading and spelling. Phonological processing includes those 3 areas, which are phonological awareness, phonological memory, and phonological retrieval. It was stated in the chapter that phoneme level instruction is the most efficient way to teach children, as we discussed throughout our presentation. And ultimately, the best approach for phonological memory and retrieval is through phonemic awareness or broader language and literacy interventions, as we discussed. Here is our references that we used for this presentation. And lastly, our 2 questions that we have for the class, we have according to Chapter 14's findings on skill selection, why is it recommended to start phonological awareness instruction directly at the phonemic level, even for very young children, rather than following a traditional developmental hierarchy? As we move along to our second question, we have Chapter 14 states that structural scaffolds are environmental simplifications such as visual supports, group arrangements, and activity sequences. What is an example of how you might use a structural scaffold to support a child's learning? We appreciate your time and we hope you enjoyed our presentation. Thank you so much.
Good job, guys. Let me finish
Yay.
recording.
I think I blacked out 4 times, but it's fine.
I did too. And I
It's
started
30.
I started talking really fast because we went a little over.
Yeah.